we are in the nursing program where we're already nurses, and we're in a master's program. So we're all nurses. We all work at different hospitals. I don't know. My specialty is mental health. I work at the state mental hospital, and I also work with special needs kids.
Okay. Hey everybody, I'm Monique Williams, and I'm also a nursing student, one of Kalila's classmates, and I work at Baptist Downtown, and I just started working with infection control, so I'm working in that particular department.
My name is Deshanti Scott. I work at Memorial Hospital. I work on the med-surg telemetry floor, so we deal with just all different things, peritoneal dialysis, we deal with HIV/AIDS patients. It's from one aspect to the next. So I'm on this diverse floor at Memorial Hospital.
Hi, I'm Michonne Butler. I'm at St. Vincent's Medical Center, Riverside, St. Vincent's, and I'm on a neuroprogressive step-down unit. I get a little bit of everything as well: telemetry, diabetes, and definitely stroke.
So we kind of just wanted to make this a little bit informal. We don't want to make this kind of boring and mundane, but just, do you know anybody that's been affected that you love by heart disease?
I just was admitted for heart failure at St. Vincent's for 7 days. I'm supposed to be having a defibrillator, life jacket on, but it keeps donging. I almost hit someone the other day. So I don't wear it because the donging is very agony, but I'll put it on tonight.
It's very important that you wear the life vest.
But usually I have it on me donging.
So you have a vest, and it's
I have a life vest.
It's temporary. Are they planning on?
They're gonna put a portable.
Okay.
One inside me. They're really thinking about that because I think my heart was like at a 15. It's supposed to be at 16 on an echocardiogram. So yeah, so they have me on a lot of medications, like 4 different medications. Yes. Sometimes I forget, but I have extra now on me just in case I forget.
Don't take extras and methadone now. You don't do that, do you?
No, I don't do that.
Do you have any family history? Where did that come about?
My mother had rheumatic fever, and my father, he had some heart problems too, as well.
So what were some of your symptoms that led you to get?
I couldn't taste my food. That was the last symptom. Before that, I was the breathing. Walking to my car was like a hassle, and I'm on Riverside in cardiology. I work on King Street. So just walking around the corner to my car was a problem, and that was going on for at least a month and a half.
Oh, wow.
And I was hesitating to go to the hospital for the simple fact I didn't have any insurance.
Gotcha.
Because I did not go for the insurance in October because I felt as though I was paying and nothing was wrong, nothing was happening. I never had no problems. And then this happened. So I was avoiding going to the emergency room, but then when I went, that's when they ran my labs and they see that everything was just out of control.
And you bring up a really good point. She was asking you, are you compliant with your medications? First of all, I wanted to say that heart disease also encompasses diabetes, cholesterol, as well as high blood pressure. But in relation to you, because I don't want to get off of that, it's very important that you are compliant with your medications because I actually came from a cardiac progressive unit. I still kind of work over there, even though I'm full-time in infection control. We're trying to reduce the amount of readmissions because we find that patients that have heart failure, typically it's like a revolving door. They end up coming back within 30 days because of non-compliance. So it's very important. I know one of the things that we do, it's one of our quality measures, is to teach our patients that if you find yourself gaining more than 2 pounds a day or 1 pound in a week, you need to call your doctor.
They gave me the scale to go home with.
Making sure that you stay very adherent to your diet and any types of symptoms that are heart failure related, that you make sure that you stay in touch with your doctor or navigator or social worker or whoever, or probably in your case,
transitional care. So, and then the doctors is right upstairs. So if anything I need, I just go upstairs and I let them know. Okay, I've gained this much, or I've, and they willing to work with me.
That's good. Very good. Anybody else with heart Heart disease, high blood pressure, anybody you know with high blood pressure? Okay.
It runs pretty steep
Okay.
in my
Do
family.
you get your checked?
Sorry.
Do you get your blood pressure checked?
Yeah, routinely when I go to the doctor.
Is
Okay.
it high? Is it
They
low?
haven't said it. They say it's normal.
So I would take the opportunity right now, since the majority of our group is African American, just to let you guys know that stroke is something that happens in African Americans the most. Some of the risk factors is definitely hypertension, so it's, you need to be very proactive, especially if you have a family history of hypertension. Other risk factors that you will probably overlook if you're not in healthcare is smoking, and birth control. Okay, so birth control, and the more you have, so if you have hypertension, you smoke, and you're on birth control, then that just increases your risk of a stroke. As far as all the statistics, I can't really give you right now, but take me on it, that, I can throw out the 17%, the 6.1, and so on and so forth. But it's definitely something that we need to be on top of, just in the community. So even if it's not you, but if it's your grandma or your sister or anybody like that, please tell them to make sure they take a statin. And that will be one of your drugs that says STATIN on the back. That's the statin. That's gonna help your cholesterol, because that's gonna thin that fat out that comes from our fried chicken and our macaroni and cheese and all that extra stuff that gives us all the thickening that we have, you know? So make sure you stay on top of that. And I don't know the insurance issues that may be at stake with Family Promise, but blood pressure can be taken at any fire station,
Publix.
Walmart, Publix.
so definitely take advantage of it.
And I just wanted to take the opportunity too to point this out, that if you do go by a Walmart or a Walgreens or someplace where you can get your blood pressure checked for free, you can take these free logs with you, and then you can jot it down. And you know, anytime you see that your blood pressure is creeping above 120/80, then maybe you might want to call your doctor. If you see it's in the 140s or 150, you may want to call your doctor, because every 20 millimeters of mercury, you increase your risk of a cardiovascular event. And that's very important. So you want to definitely prevent these things from happening. And you can have these are free, they're on the table. We also are taking blood pressure as well, just putting that out there.
Hypertension, that has a lot to do with like nerves or
It may have to do with stress.
stress.
A lot of things.
Me being here, my grandma recently, she's never had a stroke. She just had a mild stroke, but like she was in the hospital talking perfectly fine, and I guess like her symptoms were throwing up, and I guess like she fell or whatever. She was throwing up, and I guess she just felt really sick. This never happened to her before, but she has really high blood pressure. She don't use like seasonings and stuff like that, and she told me I had a lot to do with it by me, you know, just up and leaving, and I'm like, really? And she has been really stressed out, so I'm like, well, you know, who next? You know, what's going on that never
Well, stress
happened?
can definitely play a role in it,
Right.
a huge role.
Mhm.
So, and for your grandma, it may be age as well.
Yeah.
You know, just over time, because once you get a certain age, which is kind of sad,
Yeah.
but once you get a certain age, I want to say it's 65, if I'm not mistaken, but you're already at risk, just
Right.
being 65, so just being old, you at risk to have a stroke. And some of the symptoms to look for you, it sounds like what your grandma had is what we call a TIA.
Okay.
And if you have a TIA, your chances for having a stroke, the full-blown one, is more increased. So definitely tell your grandma to stay on top of her medicine. If you're the one stressing your grandma out, call her.
I'm trying to better my life.
Tell her you all right.
Right.
So she can calm down. But some of the symptoms to look for are slurred speech. If you can't gain, you know, you don't know what you're saying or something like that. If you have any type of weakness in your left or, any type of weakness in your extremities, those are signs and symptoms of a stroke. So the thing that we say is to act fast. So if you notice any of those signs and you don't know where it's coming from, call 911. Because the faster you get there, the less likely your deficit is going to be as far as you not being able to use your hands or you not being able to walk again. Most stroke patients have to go through intense rehab.
And they have a short window where they want you to get that medication. Once you pass that window, there's certain medications that they can't give you anymore. So if you recognize the symptoms, even if you don't know, it's better to go and get it checked out than just to sit and say, well, let me lay down. I don't feel right. Let me, let's just rest for a while. Even if you see somebody else and they seem like something is not right with them, it's best to get it checked out, rather than waiting, because that time that you spent waiting could really cost them abilities. So, you want to get that checked out. And since we have so many children here, we're going to talk about diet. Diet has a big part in everything. And even with the children, since we're teaching you now and telling you now, you want to make sure that you are letting them hear and let it trickle down to them, that it has to start somewhere. And diet has a big part in it. Everything we eat, when you eat stuff that's high in fat and high, salty, and it plays a big part. And even with children, even if you don't smoke, if you're around somebody that smokes, the secondhand smoke is, it's a big deal. Even if they're at grandma's house and grandma smokes, or if they're around friends and friends smoke, that has something to do with what goes into contributing to their risk factors.
And then just to piggyback off my classmates, what I'm quite sure they also see in the hospital setting is that people are ignoring the symptoms. That's the major problem. So, once your body is your defense, if you're having some symptoms, you need to act on those symptoms that you're having if it's not normal, if it's not the way your body normally reacts.
It's just like cold wolf.
Yeah,
that's what I was scared of.
Yeah,
Like, why would I go to the emergency room and there might not be nothing wrong with it?
And then, we tend to be our biggest enemies, the ones that are in the medical field, we know it all. And it can be something serious, so you really have to pay attention to your body.
And we have a saying, time is tissue. So you definitely, if your body is not reacting the way it normally